hearing about this the first time last year in February because I do some of these vascular procedures when people have leg blockages and stuff, and we could not get some of the medications and some of the instruments because they get shipped from China. So this is, I remember in beginning of February, I heard for the first time, and literally less than a month later, my entire hospital was full of patients with fulminant COVID and very desperate times.
We often kind of look at medical professionals as superheroes, right? You guys can tackle anything. You're literally on the front lines saving lives. But it seems like what you're describing was a period of uncertainty.
Yeah, it was extremely uncertain period. I remember feeling very scared, anxious, helpless at times. For lack of better words, this was our 9/11 moment where we felt like we had to go and deliver and be there for our patients and be at the front line. And yet there was a fear because it's such an unknown disease. And the fear hasn't completely disappeared. I mean, every time we walk into somebody who has COVID, we are taking risks for our own lives. And I remember last year around this time, we had no idea how fulminant this is, how quickly it gets contaminated. We didn't have some of those protective gears that we should have been given. So it definitely was a very scary time, and it required a resilience on the side of healthcare heroes and frontline workers. So I'm very proud of the community in which I work, and everything that my colleagues have done, starting from nurses, doctors, respiratory therapists, all of us.
Can you kind of take me back to a time where you had to kind of speak life into your team?
Yeah, I remember we had a patient who had a massive heart attack, and it was otherwise a young person, and we believed that he had COVID because he had some symptoms related to COVID. And this is when the COVID testing was barely available. People would come to ER, and we didn't know what to do. There were no guidelines even in terms of if somebody has COVID and they're having a massive heart attack, that means they are more fulminant and more dangerous type of COVID. What are the guidelines? What is the risk to rest of the team? If and the person needed CPR, they were going in through cardiac arrest, and it really was unclear. Some people were saying, "Oh, there are other hospitals where anybody comes with COVID, you should not be running the code because there is too much risk to the team and survival is very low." Other people were saying, "No, this person's young. We gotta do this," and the entire decision had to be made in less than 30 seconds. And I basically went in and started CPR myself, and rest of the team volunteered because there was no clarity and very ambiguity, and we did it. And actually that particular patient did ended up surviving. And I remember not having the protective gears like the N95 mask and face shields widely available at that time. It was a big problem.
So we made a lot of strides since then, right?
Yes, absolutely. I think we've come a long way. I think we still have a long way to go. uh, People want to kind of forget. People want to think, okay, 1 year COVID's over. It's as I was telling you, with mixed bag of potatoes. We have done a lot of progress. We know how to treat COVID a little bit better than what we did last year. We have few therapies available, but the progress in therapeutic area is very limited compared to what it should have been. Some of the trials were very disappointing with remdesivir and some of the other medications we think were going to truly be a game changer. They turned out not to be a game changer. Monoclonal antibodies and plasma therapies did have actually some more benefits. So we have few tools now. We know a little bit better how to treat COVID patients. The biggest progress is in prevention, right? It's is a vaccine. I think that's the big news. That so at the community level, if you don't have COVID, your likelihood of getting COVID is going to be less compared to last year. And I think that's a big progress, obviously, because community-wide, we want COVID to be extinct. But people who are getting COVID are still dying. There is a very high death rate. And I'm a circulation specialist, and I'm seeing amputations on rise, actually. People who have diabetic foot ulcers, people who have disease in their lower extremities and heart problems, they're all getting worse. And as part of it is from COVID, because COVID does cause a lot of clotting. Part of it is because of COVID, a lot of people are worried and concerned about getting their routine care. They're not going to doctors and an emergency room. They're still scared. So I think it's like a compound effect of both of these factors. But I think as far as prevention goes, as far as vaccines go, I think we are doing pretty good.
So let's talk about that because you mentioned how confidence is slowly but surely increasing, right? And how also people are just fatigued. It's been over a year and we want that connection, that sense of normalcy again. What advice can you give people who are just tired?
It's a marathon. I would say, don't, you gotta look at like the whole picture. You gotta look at a bird's eye view. And as tiring and as exhausting it is, we shouldn't put our guard down. We are almost close to the finish line, touch line. So I think this is not the time to give up or give in and just say we don't care anymore. I think this is the time that with a little bit more resilience, we can really get through this. I think large majority of people are getting vaccinated. Vaccines are over 90%, 96% efficacy in most of the vaccines. I think once we have 70% of population vaccinated, you're gonna see a huge drop in the transmission rate of COVID. So once the virus will not have too many hosts left, it's gonna go down. Same way when you have too many hosts available, it goes up like this. It's never gonna be like this. So we have to change that curve, and rather than going it like this, we were flattening it for a while, and I think now we gotta go bring it in the other direction. And we can't give up right now. This is not the time to give up and start putting our guard down. So even if you're vaccinated, I think still, simple measures, masks, social distancing. On the flip side, don't ignore your other health issues. A lot of people, especially in older age group, are so scared and worried about catching COVID that they're ignoring serious heart problems, serious circulation problem. They're not going to emergency rooms. They're not even coming to routine doctor's visit. And that's also not a smart thing to do. That's something that we gotta avoid as well.
Definitely something to take serious and to kind of talk about the perspective from the medical community. I'm sure going through all of this the past year has really reignited your passion. It reminded you why you got in the industry, I'm sure.
Yeah, it's been a very humbling experience, and I think I can speak on behalf of most of our colleagues that people felt that true calling, right?
Mm,
Sometimes in healthcare you take things for granted. It's a privilege. It's an absolute privilege to be able to go and help out people. And during this crisis, we realized that what an absolute privilege, what an amazing duty that we get to play our role. And it really has been a humbling experience. Sometimes people in healthcare, we get a god complex, right? We think that, okay, like we can, especially like when we fix complex heart blockages, valve problems nowadays, a lot of cancers. So this truly humbled all of us, because there were times when we had no idea how to help and take care of people. And we learned a lot of lessons, and we need to be prepared, because as one thing for certain is we gonna unfortunately have to deal with another pandemic in our lifetime. So if anything, if we all learn lessons from administration level, organization level to individual level, I think that will be the best gift of COVID to us.
absolutely. Dr. Shaw, is there any other final thoughts that you would like to share?
Just keep the head high. Don't give up. It's the worst hopefully is over, but it's not completely over yet. There's a lot of people still suffering from COVID and unfortunately succumbing to this disease. Family members are dealing with this. So we want to rejoice and get excited about the numbers dropping a little bit, but we still got to be compassionate for those who are going through this. And let's all act together and just be smart. And hopefully in next few months we're gonna see much better numbers.
Yes, fingers crossed. Dr. Shaw, thank you so much for joining us on News Now from Fox.
Rain, thank you so much for having me.